In this video, we'll be discussing about aspirin poisoning, its symptoms, management, and treatment. Aspirin is a non-steroidal anti-inflammatory drug which is used for the relief of pain and inflammation. It belongs to the class of non-selective COX inhibitor salicylates. It is also known as acetyl salicylic acid and inhibits COX-1 and COX-2, so it is non-selective. How much is the toxic dose for aspirin? In case of mild toxicity, it is 150 mg per kg. For moderate toxicity, 300 mg per kg. Severe toxicity, 300 to 500 mg per kg. In lethal toxicity, greater than 500 mg per kg. Inappropriate dosing in both children and elderly is one of the reasons for aspirin poisoning. Accidental or intentional overdosage could also happen. The symptoms of aspirin poisoning include the earliest symptoms are ringing in the ears or tinnitus, abdominal pain, lethargy, dizziness, nausea, and vomiting. Later signs of poisoning, or in the case of more severe poisoning, the symptoms are high body temperature or hyperthermia, rapid breathing or hyperventilation, respiratory alkalosis, metabolic acidosis, dehydration, hallucinations, drowsiness or confusion, bizarre behavior, unsteady walking, and even coma. The most common cause of death in aspirin poisoning is due to cardiopulmonary arrest, which is usually due to pulmonary edema. How is the management of aspirin poisoning done? First off, taking a history and performing a medical examination to look for the evidence of poisoning. Monitoring of biochemical parameters such as electrolytes and solutes, liver and kidney function, urine analysis, and complete blood count is undertaken along with frequent checking of salicylate and blood sugar levels. The doctor will check any vital signs such as breathing, increased body temperature, etc. Moving on to the treatment, there is no specific antidote for aspirin poisoning. Gastric lavage may be beneficial up to 60 minutes after ingestion. Activated charcoal is given 50 grams by mouth to absorb salicylates and prevent its absorption from the stomach. People who have been severely poisoned may be given repeated doses of activated charcoal. Alkalinization of urine by sodium bicarbonate IV corrects acidosis and enhances excretion of salicylate into the urine. An anticonvulsant such as IV diazepam is also given if necessary. To correct dehydration, IV fluids are given to the patient. Hemodialysis can be used to enhance the removal of salicylate from blood in severe poisoning. Recovery is likely if the dose of aspirin is not too high and proper treatment is given. Now let's take a look at Reyes syndrome, which is related to aspirin. This syndrome is mainly characterized by swelling in the liver and brain. It is most common in children and teenagers recovering from a viral infection, mostly flu or chickenpox. Aspirin has been linked with Reyes syndrome, so use caution when giving aspirin to children or teens for fever or pain. That's all for this video. Make sure you check out other pharmacology videos.